Welcome to Top Wise. Here are 12 life hacks that assist you in surviving emergency circumstances. Information from friends or family members is the first thing that springs to mind when faced with a decision. However, even the most well-known and popular ideas might be incorrect and detrimental in some circumstances. Did you know that putting ice on a bruise is not a good idea, and that lifting an unconscious person might have severe repercussions for the person who does it? Number 1. Rubbing an alcohol or vinegar solution into the skin of someone who has a fever. Since vinegar and alcohol are absorbed into the bloodstream, it is a convenient method to become intoxicated or to produce a zany salad dressing. Seriously, alcohol rubbing has the potential to cause drunkenness, while vinegar will greatly increase acidity, which is harmful to the patient. Consequently, take these outmoded bits of advice with a grain of salt. Let the patient drink plenty of fluids, including water, tea, and other non-alcoholic beverages. To achieve a temperature of 61 to 64 degrees Fahrenheit, 16 to 18 degrees Celsius, chill the air in the room. Patients are expected to recover from their fever on their own. If they do not, they should consult with their doctor. Number 2. Using sour cream to cure burns. Many assume this strategy is beneficial since it alleviates their discomfort. However, why do butter and sour cream help you feel better in the first place? We store them in the fridge so that they are still cold when we put them on the burn. On the other hand, butter and sour cream can potentially dry up your skin and interfere with heat exchange. Thus, heat has nowhere to go except deeper into the skin, resulting in even more damage. What you should do is place your hand in a bowl of chilly water for around 15 minutes. This will alleviate some of the discomfort. Is it possible to explain why blisters form on the burned area of our bodies? Everything occurs for a purpose. Blisters protect the area from infection, and removing the protective covering may result in an infection of the wound itself. Number 3. Dealing with a foreign item in the eye. The first thing you should do if you have anything in your eye, such as a piece of glass, is to call for help and have someone drive you to the hospital. If the item is just one eyelash, be sure to wash your hands well before doing anything more with it. Look in the mirror and see if you can find the missing eyelash. Make your tears come out by blinking. Take a moist piece of cloth and gently wipe the eyelash out of the corner of your eye after the item has been removed from the corner of your eyes. Number 4. Putting ointment on a wound. Ointments include unwelcome dampness, which provides an ideal habitat for germs to proliferate at an accelerated rate. It is advisable to clean the area with cold water and soap before applying a dry bandage to it. You will notice that the wound heals more rapidly this way. Number 5. Fixing a bone on your own. Are you a trained trauma surgeon with years of experience? If this is not the case, you should never attempt to fix a dislocated joint yourself. No matter how awesome or savage it seems in the movies, it is possible that it may result in more injuries and a subsequent lawsuit. Keeping the wounded leg immobilized and rushing to the hospital as soon as possible would be the best course of action. Bandaging the limb in a comfortable posture is important in mobilizing not only the area of suspected fracture, but also the 2 nearest joints as well as the rest of the body. Number 6. Applying heat to an injured part of the body. When your muscles are strained, a warm cloth will not be of any use. Heat, on the other hand, will increase blood flow, which will result in more severe edema. Coal should be applied to the injured area in the first several days following the accident. It will help to reduce inflammation while also alleviating pain for at least the first 48 hours. Attempt to keep the sprained limb as still as possible and avoid using it. Number 7. Make oneself vomit. In the event of poisoning, the typical advice for poisoning is to force oneself to throw up. Although it seems to be rational, it is in fact absolutely banned by law. First and foremost, the toxin has the potential to enter the lungs and cause harm. The second issue is that if someone has been poisoned by particular chemicals, vomiting increases the likelihood of burning their throat by 2 to 1. In addition, it may be very difficult to stop vomiting once it has begun, which may result in dehydration and even more serious effects. As a result, the only sensible thing you can do in this case is to contact an ambulance as soon as possible. Number 8. Saving a person who is drowning. There is just one snag in your plan to save a drowning individual who is unable to swim. You don't know how to swim. If you are, however, there is nothing that can stop you from saving that person's life. Just remember to approach them from behind so that they aren't aware of your presence. The individual may restrict you or pull you down as a result of their terror when they see you approaching the person. Get hold of them beneath the armpits or by the chin and drag them to the beach while maintaining their head at your belly. Number 9. Removing foreign items from wounds. You may now remove a splinter from a finger or a tiny glass shard from your hand, but you should never attempt to remove things from a major wound or puncture wound. Even physicians leave them in place until the patient is ready to be operated on. Essentially, while the device is within the wound, it prevents the bleeding from starting. You should refrain from touching the item until you are under the guidance of a qualified specialist. The only thing you can do is apply some alcohol to the cut, but you must be prepared for the wound to be quite painful as a result of this. Whatever the case, don't attempt to be a hero by going to the hospital instead of getting a splinter out of your leg. Number 10 is to apply ice to a bruise. There is nothing inherently wrong with treating a bruise with ice, but the vast majority of people go about it incorrectly. To avoid getting a cold burn, you should avoid immediately applying ice to the skin while exercising. Instead, place a piece of fabric between your skin and the ice pack. Nonetheless, even using a piece of cloth does not eliminate the possibility of getting burned. If, for any reason, you don't have a towel to use, you should only put ice on for a maximum of 20 minutes at a time and then take a 90-minute rest. Never, ever utilize ice in any way. Believe us when we say that a bruise would be preferable to a cold burn any day. Another thing to keep in mind is that applying ice to the injured area for the first 48 hours following the injury is pointless. Number 11. Pulling an unconscious individual out of their bed. If someone passes out, you must immediately pull them up and spray some cold water on them to revive them. That is, after all, what the majority of people believe. If you like this video, please share it with your friends. Lifting a person who has fainted, on the other hand, can simply intensify the spasm. What you should do is raise their legs over their heads, unbutton any clothes that are too tight, and don't allow them to stand up on their own. Number 12. Close cuts by stitching them together. It is not incorrect to use sutures. In fact, in most circumstances, they are the only option to repair a wound. However, placing stitches is a time-consuming and unpleasant technique that needs the stitches to be removed once the wound is healed. Therefore, in certain circumstances, a less severe solution may be preferable. Skin glue is a rapid and completely painless method of adhesion. Clean the wound with cold water before using skin glue, and then stop the bleeding by pushing the wound tight to the margins of the wound and applying skin glue on top of it to seal the wound. If, on the other hand, you see that the wound is excessively large, don't take the chance. Go to the hospital for expert assistance. Please give this video a thumbs up if you found it informative, and share your first aid experiences with us in the comments area. Share this with your friends so that they aren't left in the dark about what to do when someone needs aid. Of course, subscribe to our channel. Thanks for watching.